All right, here's a question for you. Have you really paid a lot of attention to your feet at all? Do you notice when they're a little achy, maybe from standing, or when you need to do a fresh pedicure? But there are some other things that you need to look for to make sure that your feet are healthy. And joining us now is Dr. Carrasquillo. He is an orthopedic surgeon and foot and ankle specialist at the Jacksonville Orthopedic Institute. Thank you so much for being here. We appreciate you. Let's talk a little bit about bunions. And I know this might be something that people say, oh, I have a bunion, but it's never been a problem. Maybe it is a problem and I don't know about it. So let's first start by talking about what they are. What causes them?
Yeah, bunions are a bumpy, bony deformity that happens at the base of the big toe, forcing that big toe towards the second toe, and it can cause quite a bit of pain.
And so how is this happening? How are we getting those? Obviously, we're not born with a bunion, so what are we doing then to create those?
Well, it's a kind of a multifactorial problem where genetics definitely play a role, and also shoe fitting as well as possible trauma can cause some damage that leads to the formation of the bunion.
Okay, so with the trauma, obviously we would like to prevent something like that. Are the shoes that we are wearing or something that we're doing in our day-to-day life causing this problem, or perhaps exacerbating a pre-existing problem?
Certainly. As you can tell, shoes that are narrow into the toe box can push and cause a deformity, and that can lead to a bunion.
Okay, so let's talk about, first of all, at what point in time we want to come and see you. So is it when it starts to be painful, or when we start to notice something? If we don't address this problem soon enough, is that only going to create more problems for us in the future?
Certainly, the deformity can be progressive, and it's usually when it starts affecting activities of daily living and having pain or problems with shoe fitting that people come to see me in the office.
Okay, and the shoe fitting, I mean, for us women, that's tough. I mean, we just want them to look good, you know, so sometimes we're not always thinking, oh, I got to make sure we have the, what do we need to make sure that we are doing with the shoe fitting to make sure that we don't create something like this?
Well, certainly you want to fit the shoe to your foot, not the foot to your shoe.
Okay, we'll work on that. Well, that's first and foremost. Okay, so let's say we do have this problem and we come in and see you. How then are bunions treated?
Certainly. First of all, not every bunion is the same, and you have to understand the pathology behind the deformity to be able to determine what's the best course of action for that particular patient. But it could be as little as modifying the shoe where there are no straps or seams, putting pressure over the bunion, to surgeries that are intended to realign the toe and stabilize the foot in order to allow comfortable shoe fitting.
Can bunions go away if treated properly without surgery? You were talking about making sure that your shoe is perhaps fitting better so that you cover the bunion. Is there a way for this to go away on its own?
The bunion will not go away, but you can certainly fit it properly so it will not affect your activities of daily living or cause any pain.
Okay, let's go more in depth on this surgery then. At what point in time does the patient realize, or do you realize upon diagnosis, that you have to have surgery?
But first of all, pain is a driving force behind it. Once you cannot fit that shoe that you want, then you have to consider surgical options.
And when we come in for surgery, is this a one-day type surgery? What is the surgery, I guess we'd say, what happens after the surgery? Are we able to walk, the recovery process?
Certainly. This day and age, surgery for bunions is an outpatient procedure that can be done either in an office or a surgery center. The recovery varies a lot depending on what type of procedure is being done. If you have something that is mostly soft tissue and minimally invasive procedures, they can be up and running as little as 2 weeks, where there's some that requires stabilizing part of the foot, and that may take up to 3 months before they are functional.
And then is this going to then alleviate the pain? The surgery, is this take care of the problem?
That's the whole idea.
Yeah, well, sometimes, you know, you take the surgery and, you know, maybe you're going to get the pain will be minimalized, but it won't totally be eradicated. And you're saying that this is a great way of getting rid of the pain.
Correct.
Okay, let's talk about an event that you are very passionate about that is going to be going on this Saturday. And it's something called Our Hearts to Your Souls. And this is going to be at the Sulzbacher Center. Talk about what that is.
Correct. Our Hearts to Your Souls is a wonderful non-for-profit organization that nationwide provide shoes to the homeless during the Thanksgiving holiday. We've been partnering with them for the past 8 years, and we're doing the event this upcoming Saturday.
And this is something that the physicians will be volunteering for, so you're all manned in that regard. But if the viewers are watching and they would like to help your efforts, they can make a donation. Is that the best way to help?
Absolutely. You can go to Our Hearts to Your Souls, and it's not only physicians, but the whole staff at JOI will be going to help at the Salzbacher Center.
Fantastic. Well, thank you for that. And thank you for coming on today. We certainly do appreciate you. And thank you to the Jacksonville Orthopedic Institute for coming on and sponsoring this segment. For more information, you can visit joi.net or call 904-JOI-2000.